often asked, but when and how should I use Bob? Well, our goal is to help guide you the very best we can, and we wish to shed light on the variety of implementation techniques available, as there should be no reason to not benefit from Bob. The only reason why Bob should not be used is if it is physically not possible or inappropriate to do so, and therefore that is dependent on the clinical discretion of the professional. Bob can be utilised during consultations, regular hygiene and maintenance appointments, and even during complex treatment appointments. However, it is also important to note that even if you wish to, and it is necessary to complete a more detailed and in-depth bleeding index, Bob can still assist and support you and the patient with the interdental mouth map, which they can take and access at home. So Bob is there to assist all of us, not only hygienists, but also dentists, specialists, and other dental professionals who have the ability and qualification to complete or intraoral hygiene instruction and coaching. And for professionals who are working within a dental office, we generally recommend them to start a Bob score with the patient in the supine position, as this gives the professional the best access with ease and a higher amount of visibility. So when completing the bleeding index, it's highly visible. However, it is also possible to complete the score with cheek retractors for improved accuracy, but it's not paramount. In certain situations, for other professionals, or if using Bob when out of a dental setting, such as on a course or workshop, it is possible to use the Bob app with the patient or delegate in a sat upright position. In this position, even if used in a dental office setting, the review and coaching can commence without changing the position of the patient. It is always recommended to start an appointment with Bob unless it is not possible to do so or inappropriate. The reason for this is that when aiming to change a behaviour of a patient, it is important to educate and inform the patient when there is an increased feeling of positivity, less discomfort, and when there is still the duration of an appointment with the patient still feeling eager for their dental treatment to begin, such as their dental cleaning or dental debridement as it's called, and as they love, the dental polish. So, as you may have noticed already, once the dental cleaning is complete, a patient's attention span to you and your information, including any advice and intraoral demonstrations, is usually reduced or lost completely. Nervous patients or patients with a tight schedule will always be focused on leaving the dental room at the end of the appointment, when of course they've had their dental treatment. Therefore, information on oral hygiene is usually not retained. This can be because of their lost focus or the discomfort, such as sensitivity they possibly feel post-clean, which may then enforce the feeling of course, wanting to leave the dental room as soon as possible. Therefore, it is always recommended starting a clinical appointment with the Bob app. For new patients in particular, it is often perceived as a unique, gentler, kinder, and a more accepting introduction, which will in turn build a stronger and quicker rapport with patients who will want to return to your clinic for future appointments. This factor is also appreciated with regular patients and even phobic patients, as by starting an appointment with Bob, it enables them to ease into an appointment with communication and education from the beginning. We always recommend that after the professional has input the Bob information, he or she then sit the patient upright to complete the review for themselves and the patient before any dental cleaning commences. The reason for this recommended position is because this is the position the patient is most likely to be in at home when cleaning interdentally. So it gives the most lifelike and atraumatic experience when the patient is practicing their technique in which the clinician has taught. It is also seen as a separate treatment compared to the obvious dental treatment, and therefore the patient begins to take ownership of their own oral hygiene. Lastly, the patient is more relaxed as this position equalises the relationship between the patient and the professional. The reason why the review and coaching are recommended prior to any dental treatment is for the same reasons as why we recommend to start an appointment with Bob. However, we are aware that sometimes it is not always practical or possible. Therefore, we recommend a third option for completing the review and the coaching, after, of course, the dental cleaning. This is the Bob Silent method. The review also allows the professional to adapt the interdental chart and minimise the number of interdental aids depending on the type of patient that is present. The patient view button also allows the patient to see their chart as a mirror image of their own mouth, and this will be the same image they will use at home when completing their own interdental cleaning. The patient can then demonstrate back to the professional the technique which was taught, along with the clinician completing touch-to-teach methods with the patient. If the patient struggles with a particular aid or size of interdental, then at this point it is still possible to change the interdental aid to best cater to that individual patient. Once the review and coach has been completed, it is time to complete Bob and allow the patient to receive their own personalised score. Therefore, it is always recommended that the patient clicks the Finish button so that they take ownership of their own Bob score and therefore their own health and well-being.